Back pain. It affects more than 80% of all Americans at some time in their life. Those who suffer from chronic and debilitating back problems usually become mentally as well as physically drained, causing them to miss considerable time from work and be unable to participate in normal activities.
Almost everybody has back pain at some time in their life. It's usually nothing too serious. Usually it's a muscle strain, they pulled something, even a ligament strain, sometimes a joint strain. Sometimes it's arthritic changes that come and go. For other people, they have more serious problems. And those problems usually are either from disc herniations, degenerative disc disease, sometimes arthritic changes of the spine, and they're really crippled by the pain.
It got to the point where I couldn't stand. It was hard to walk. It was just as painful getting up in the morning as it was going to bed at night.
Every year, millions of people elect to undergo major surgery to alleviate their back pain. Not only are traditional back surgeries known to be severe and invasive, the post-surgical rehab can be painful and often ineffective.
Certain problems are only fixed by fusion surgeries. They require large incisions in the back. They require the need to stretch out the back muscles really far, and that causes a lot of pain after surgery. A lot of times these may not be successful. Even when they are successful, there's a long recovery period, a long painful recovery period, and a lot of times patients need a lot of narcotics after surgery, and that narcotic use could cause a separate problem.
Today, doctors across the United States are treating a variety of spinal conditions utilizing new minimally invasive procedures. Because of this new approach, patients can experience less painful and faster recoveries towards achieving their body's normal range of motion.
Going to work was even tough, the 45-minute drive. Very uncomfortable. I couldn't just stop and get out of the car and move around. And then on the day of surgery, I get in there and get the surgery, and 3 hours after the surgery, I'm up and walking with no pain.
When you're coming from the lateral approach, the approach from the side with the new minimally invasive ones, you're actually spreading the muscles apart so that they don't have to heal and scar in. And the overall effectiveness is equal, if not better, because it's a less invasive approach.
Minimally invasive surgical techniques, such as the XLIF and ILIF procedures, decrease the need for muscle retraction and the disruption necessary to perform the same operation as compared to more traditional spinal fusion surgeries.
It definitely exceeded my expectations on recovery time and the pain I had to go through.
The minimally invasive surgeries offer a lot of benefits. They have shorter hospital stays, less pain, quicker recovery, smaller incisions, and that really translates into the patient feeling better, and the patient in general gets back to their life and become productive members of society much quicker than traditional surgeries.
Board-certified neurosurgeon Dr. David H. Segal is one of the country's leading specialists in brain and spinal surgery. Practicing in Cedar Rapids, Iowa, people come from near and far to receive the minimally disruptive surgical solutions offered to his patients for treating degenerative spine conditions.
When I met Dr. Segal, he went over the MRI with me and explained exactly what he was able to do and what it would do for me.
Dr. Segal and his staff have been unbelievable. He's quite a gifted man. I can hold my granddaughter again.
Dr. Segal successfully treats spine abnormalities with a combination of minimally invasive techniques that bring advanced technology to an age-old disease, reducing the surgical trauma and discomfort experienced by each patient.
We go over the options with every patient, surgical and non-surgical, and we're going to get the best plan for every patient. They're going to understand what's going on, they're going to understand what their choices are, and understand what the plan is.
The XLIF and ILIF procedures are options for lumbar fusion surgery candidates and have consistently garnered exceptional results because of shorter surgical times, less blood loss and tissue damage, and a more rapid return to normal activities.
The XLIF procedure stands for Extreme Lateral Interbody Fusion. It's a minimally invasive way of doing a fusion. With XLIF, there's a small cut on the side, and through that cut, we put in a retractor, we get down to the disc, scrape out the disc, and put in a large implant in between the disc that will prompt fusion as the weeks go on. ILIF stands for Intralaminar Lumbar Instrumented Fusion. It's another minimally invasive surgical technique, which I've had tremendous results with. So we are doing a fusion of the spine. That's going to help any kind of instability or arthritic joints. I'm taking off arthritic buildup, and I'm widening the space for the nerves. Compared to more traditional surgeries, especially traditional surgeries which would do anterior and posterior fusions, this is remarkably smaller. People do remarkably better. They're usually home in 2 days and walking right away, even with both done at the same time.
If you or someone you know is experiencing back pain, please call 319-861-7860. Or for more information about Eastern Iowa Brain and Spine, please visit eibrainspinesurgery.com.